Good evening, Rolly Hoyt here with Craig O'Neill. Let's not make any predictions about the direction of the COVID fight and how it's going, but there are some encouraging signs in today's numbers.
We came down off some record highs, but we remain in the middle of an unprecedented state with the Delta variant out there. The easiest thing to do is to run through the numbers as we got them. Here we go.
A little more than 2,300 cases of COVID-19 added to the total count in the last 24 hours. That's according to the Department of Health. That's more than 600 fewer compared to yesterday and also lower than last Thursday. 24,443 cases are considered active. The stats show that 84.6% of those are among the unvaccinated.
COVID-related hospitalizations are down by 50 this evening to just under 1,400. That's the first decrease we've had in that total since last Friday. But even still, the number of COVID patients on ventilators is the same as yesterday at 296, and 30 more Arkansans have died from the virus.
I understand that pregnant persons sometimes are afraid of vaccines and other interventions, but I'm afraid of what this virus is doing.
More stats for you here. Only 23% of pregnant people in the U.S. are vaccinated. We told you yesterday how the CDC updated its guidance for them and others trying to become pregnant, citing growing evidence that the vaccine does not increase risk of miscarriage.
And here at home, it's a decision that isn't easy to make for some moms. THV 11's Frederick Price spoke with one woman who says she isn't quite ready to be vaccinated.
Well, Craig, vaccine hesitancy is something we are seeing everywhere, and one group of people that health experts are now concerned about are pregnant women. Getting the shot in the arms of those who are expecting is more important than ever.
I completely understand hesitancy in pregnancy. It's a time in your life that you truly aren't thinking so much about yourself as you are this unborn child.
For months, women's health experts have been pushing for pregnant patients to get vaccinated. But for soon-to-be moms like Kiara Smith, that decision isn't an easy one.
I feel like it's gonna possibly harm my baby.
Smith is 8 weeks pregnant and has talked with her OBGYN about the risks of getting a COVID-19 vaccine.
My doctor told me that he recommends that I get it because it's safe for me and my son.
But right now, she says it's just too soon.
I want to wait till after I have my child.
And she's not alone. Tens of thousands of pregnant Americans are hesitant to get the vaccine. It's a scary trend for doctors like Nirvana Manning with UAMS because she says women who are pregnant that contract COVID-19 can have a more complicated pregnancy course.
There's an increased risk of respiratory problems. There's an increased risk of intubation. There's an increased risk of ICU stay.
And since COVID attacks the respiratory system, the reality is that when soon-to-be moms don't get enough oxygen, the unborn child is likely not getting any either, creating a scary situation and, in some cases, an early birth.
In many of those severe cases, we've had to deliver the baby prematurely in order to be able to resuscitate the mother as fully as we need to.
This week, the CDC strengthened its recommendation for pregnant women to get vaccinated. Manning says in the end, it's the mom's decision. But having that discussion with patients puts some minds at ease.
I think there's some that just truly want to hear the data. They want to hear it from their healthcare professional, and they just want to be reassured that it's safe.
And Smith says once her son is born, that's when she'll consider getting the vaccine. Dr. Manning says they are offering vaccines in their clinics, so once she discusses it with the patients, they can go ahead and get one immediately.